diagnosis that affect the locomotor system, including the muscles, joints, bones, etc., as enumerated in the International Classification of Diseases, 10th revision. These conditions vary from sudden and short-lived, such as sprains, strains, and fractures, to long-lasting conditions associated with ongoing pain and disability. Occupation-related musculoskeletal disorders are often associated with persistent pain, which may lead to limitations in mobility and functional abilities with associated impacts on the mental well-being. The most common and disabling musculoskeletal conditions are osteoarthritis, back and neck pain, and systemic inflammatory conditions such as rheumatoid arthritis. The textile industry in India is the second largest manufacturer and exporter globally, succeeding China as per the 2019 reports. It is one of the largest sources generating jobs in our country with more than 46 million people. So this study was conducted in Kolar, which is a salient junction identified under the Bangalore-Chennai Industrial Corridor, and contributes around 1.89% to our state, that is Karnataka's GDP. There are around 13 ready-made garment factories providing employment for more than 8,000 workers. So the textile industry workers mostly report pain in the neck, back, and shoulders, which may be attributed to the nature of work, which involves prolonged sitting, repetitive work, vibration, incorrect work postures, and extensive workload. So in our study, we were intrigued about the length of sickness absence as an estimate of the chronic persistence of musculoskeletal conditions. So our study aimed to estimate the prevalence of these musculoskeletal disorders and the factors which caused them among the women employed in the garment factories. The second goal was to determine the predictive factors for the length of sickness absence due to the musculoskeletal disorders and evaluate the association of these factors with time. So the methodology which was followed here was the prospective observational study design, where the workers were selected from the Kolar Taluk, known as the Belambari Industrial Area, which has a ready-made garments factory with more than 800 employees. The time duration during which the study was conducted is between Jan 2019 to February 2020. And the workers involved in three main sections of the garment factory were involved, and a sample of 430 were selected. Here we used the multi-stage sampling, where out of the three garment factories in our field practice area, we selected one. Among the workers employed, 430 workers were selected by simple random sampling, and the inclusion criteria was that.
Ma'am, sorry for the interruption.
Yes.
Please, we cannot see your slides properly. Please move the slides.
Is it visible now?
Yeah, is it visible? But please move the slides for further information that our audience can see.
Okay, I'm actually changing the slides, but I don't know whether it is changing on the Zoom platform.
Ma'am, you just click over there here. One slide show option is there. So just click there.
I have clicked on the slideshow option.
You just try by clicking on one by one.
Did the slide change now?
No, ma'am.
It is not changing, is it? But it's changing on my screen. What about now?
Now it has changed.
Okay. So when I put it to slide share mode, I think it is not visible. So can I continue like this?
Yes, ma'am. No issue.
Thank you. So the inclusion criteria were age of more than 18 years and those who had at least 1 year of working experience. Pregnant women and disabled individuals were not included in the study. And the data collectors were trained in such a way that they could use the Nordic questionnaire, which is the 9 pain point questionnaire. And this is the picture depicting the 9 pain points. The entire questionnaire is not depicted, only the main pain points which has been included and represented in the results has been shown here. So we attempted for a different approach in analyzing the factors predicting the length of sickness absenteeism due to the musculoskeletal disorders. After collecting the baseline data about the prevalence and factors affecting the MSTs, a longitudinal prospective study was conducted for the next 12 months. Workers taking 2 to 6 weeks of leave were included and followed up for a year to determine the predictive factors for the length of sickness absence. This selection was made based on the confirmatory clinical diagnosis as given by a trained medical officer placed there, as well as by the details obtained from the registry maintained at the factory. The perception of physical load was also measured using a rating system on a 10-point scale. To analyze work-related psychosocial factors, the job content questionnaire was employed. The pain severity as perceived by workers was assessed using a 10-point scale, and the functional disability associated with illness was evaluated using the Rowland-Morris disability questionnaire. Ethical approval was duly taken by our institute, and the data was analyzed using the SPSS version 22, which is used for the statistical analysis. So let's discuss the results. Here we have the demographic characteristics of the participants, where when you see the age group, most of the participants were in the age group of less than 30 years of age, and most of them were educated, that is 43%, only up to primary school. The occupation as suggested into 3 sections, where the warehouse and the iron section was considered to be similar. And most of them belonged to the sewing operation, which involved more strenuous activity. And most of them had overtime, that is worked for more than 8 hours and with a minimal monthly income, that is in Indian currency, rupees less than 7,000. And when coming to the BMI, because it is a work which is done and stationary and not much of movement, the BMI was found to be either normal or overweight. So table 2 shows the distribution of the study subjects according to the standardized Nordic questionnaire, which was depicted before. That is the 9-point which is being used, and it has been divided into 2 halves. And as you can see, the different areas or the pain points which were considered, and we considered the history of pain for the last 12 months or the past 7 days, and also a history of disabling attack was taken. And a conclusion was made that a disabling attack was seen more among the people, as we can see in the next slide, complaining of the problems of lower back, followed by that of the upper back, and then followed by that of the neck. And this finding is in consensus with most of the musculoskeletal disorder studies or the study on the occupational health all through the world, especially the developing world. And these findings were found to be statistically significant as shown by the probability value. The figure 2 shows the musculoskeletal pain related effects on the different body regions, and lower back being the most affected, followed by the upper back. The association of factors with 1-year prevalence of musculoskeletal disorders in different regions of the body is as given below, where we compared the association found in the previous results compared with that of the factors affecting them. Because most of the factors did not have a significant value, we did not depict the entire table for each of the factors. But as we can see, the predictive factors according to the chi-square values and the p-values were found to be significant with the daily working hours. With more working hours, the problems or the complaints relating to the different musculoskeletal disorders were quite high. Now, this table stratifies the absence due to musculoskeletal disorders by affected body part. And this also shows that the most common complaint of lower back is a reason for sickness absenteeism, followed by that of the upper back. And a univariate and multivariate analysis both were done to get more clarity on the predictive factors for the length of sickness absenteeism because of these disorders, that is between 2 to 6 weeks of leave being availed. The univariate analysis and the multivariate analysis showed an hazard ratio, which is considered to be significant if it was more than or equal to 1. And it was found that the physical factors were the main reason for the sickness absenteeism apart from the severity of the pain which was perceived. So coming to the discussion, this is one of the distinctive prospective studies which we conducted in the south part of India to assess not only the prevalence of the musculoskeletal disorders, but also to analyze the predicting factors contributing to workplace absence. The participants employed in the garment factory included in our study were women and were in the 18 to 30 year of age group, indicating that more women belonging to the class of early working age population are employed in garment factories than men. There's an increasing demand for products from the ready-made garment factory sector, especially of export quality in our country, and more so in the industrial area of our district, which leads to an escalated demand and the direct impingement of this in overtime working. This results in poor health outcomes among the workers, and the main predictors found to be connected with the long duration of sickness absenteeism were poor interpersonal relationships, perceived pain, high perceived physical workload, functional disability, and a need for a medical visit 12 months prior. Employees with a higher perceived physical load of work showed a more leisurely pace of return to work than others. And the findings of our study regarding the importance of perceived pain are consistent with the studies conducted among factory employees on sickness absenteeism. Even though there are not many studies in our country that concentrate on the importance of predictive factors for the length of absence from work, some studies have shown that physical workload is a significant factor in the length of absence from work. So the effect of pain intensity on the duration of sickness absence remained constant and was independent of adjustment for perceived functional disability. Even though disability affecting function is an important predictive factor for an extended absence from work, the results showed that greater initial intensity of pain overrules the functional disability. And another suggestion is that terrorizing thoughts of their effects can be minimized by changing their beliefs and improving their capability to perform physical work effectively. Having said that, not just positive psychological reinforcement, but also effective programs at work, such as encouraging and teaching proven muscular exercises to avoid outcomes of these disorders, are crucial. This can only be achieved by creating a work program that encompasses an ergonomically suited work environment, resting hours, health education about work postures, and healthy interpersonal relationships. To conclude, as disclosed by the 12-month prevalence, the lower and upper back were the most commonly affected anatomical regions. It was also observed that lower work experience, longer working hours, and higher BMI played a role in causing these musculoskeletal disorders. So the predictors for absence due to these disorders revealed that, along with physical work, overload pain perception had a predominant role in the duration of absence. Hence, a healthy work environment that is ergonomically acceptable with considerate rest periods will help enhance their productivity. This can be achieved by interventions tailor-made to fulfill the needs of the workers in terms of ergonomics, such as postures of sitting or standing and hand movements, exercises to strengthen the musculature, psychological or psychosocial well-being, and finally, yet importantly, to strike an exact work-rest balance. Therefore, the recommendation of low-cost solutions is essential for providing adequate health education to workers regarding ergonomics with respect to work posture, duration of repetitive work, and mandatory resting after 4 to 5 hours of continuous work. These should be made an integral part of the work policy and be implemented effectively. These are the references. Thank you.
Is anybody having any questions, so they may proceed further? Okay. So thank you very much, ma'am, for your valuable time and excellent presentation. Thank you. Thanks a lot. And